So the position statement has put the MITRA France trial and the COAPT trial in the context of wider treatment. And broadly speaking, we've looked at the trials in detail. Alongside other authors and other experts from around the world, we recognise that there were important differences between the studies. Patients in COAPT had more severe mitral regurgitation and smaller left ventricles. They were already taking optimal medical treatment before randomization. And finally, the edge-to-edge repair technique in COAPT was arguably better than that in MITRA France, with more use of multiple clips and better echocardiographic outcomes at 1 year follow-up. So for that reason, PCR and EAPCI endorse the results of COAPT and recommend selection of patients for transcatheter edge-to-edge repair based upon the COAPT selection criteria.
Well, this is very important. And Francesco, do you think we need to add something more, a second step to all this?
Well, I think one of the main messages of COAPT trial is that it is a synergy trial. It is a trial that shows that MitraClip works in selected patients who are well treated by experienced operators, and it is a trial that achieves outcomes which are, I would say, superior to the average outcomes that we have been observing in Europe, probably because of patient selection, but most important because these patients have been managed in a synergic way together with the heart failure specialists. So they had the best of the two worlds. So the key element, I think, for the next step will be to find a way to get more synergic rather than alternative. Till today, I would say the mitral interventions have been seen very often in Europe as like a last option for these hopeless patients. And I think mitral FR reflects somehow the trend that you use these devices like magic, like almost like an alternative to transplantation. I think we should understand that these therapies work better in an earlier stage, and only by engaging the heart failure community, the referring cardiologists, maybe even the family physicians, will be fundamental to obtain better outcomes and impact on survival of our patients.